Patients with dry eye is a prominent part of my practice. Ophthalmic consultants on Long Island and myself, we were involved with the development of the current treatment for dry eye, the only approved treatment for dry eye being Restasis or topical cyclosporin. We were involved from the very onset of that research, and as a result have seen and treated large numbers of dry eye patients. Now, dry eye can run in a whole spectrum of disease. It can begin with just people who actually have increased tearing. Why would their eyes tear when they have dry eye? Well, there's actually two forms of tear that are necessary to keep the eye properly lubricated. The first tear is called the basic tear. That's the tear that coats the eye all the time. It has to be there. If it isn't there, the eye simply will break down and have severe problems. Your eye must be covered by some kind of lubricant at all times. That basic tear is secreted at a constant level. The problem is it can't ramp up production when something happens, such as you're in a dry environment and it evaporates, the cold wind blowing on your face. Now, when we're young, the basic tear is pretty thick. It takes a lot to make it evaporate. As we get older, that basic tear level begins to thin out. It doesn't produce as much. So environments like, as I said, a cold, windy day, or staring at a computer for long periods of time without blinking, without replacing that basic tear, or driving a car with the air conditioner blowing on your face or the heater blowing on your face. These are all elements that will cause that basic tear to evaporate. Now, when that starts to happen, you feel burning in the eyes. And the second thing that happens is the eye tries to replace it, and all it can do is turn on reflex tearing. Well, reflex tearing, that's like crying. It's either on or it's off. The faucet's on or it's off. So in response, your eyes can start putting out more tears in order to replace the basic tear. When this occurs, often the best thing to do is to try and replace that basic tear by using an artificial tear as a lubricant. Close the eyes briefly to let it rehydrate and shut off the reflex tearing. If, however, it's occurring frequently, despite this approach, then again, you may be a candidate for Restasis. It's something you should discuss with your doctor. We've seen this problem many times, and we should take a look at you and tell you what would be best for you.